Last week, President Obama, in responding to the killing of school children in Newtown, Connecticut, given his policy response, said that the most important priority we have as a society is the safety of our children. This is what we will be judged by. So I think we are honored to have with us today the world's advocate for the safety of children, Marta Santos Pais. Marta is the special representative of the UN Secretary General on Violence Against Children. She has more than 30 years' experience in human rights issues, engagement in the UN and intergovernmental processes, and a firm commitment to the rights of the child. She joined UNICEF in 1997 as the Director of Evaluation, Policy, and Planning, and was the Director of the UNICEF Innocenti Research Center from 2001 to 2010. She has played a key role in guiding international and developing international human rights standards. In particular, she was a member of the UN Drafting Committee of the 1989 Convention on the Rights of the Child and its two optional protocols. So I believe that if, as President Obama said, we will be judged by the extent to which we protect the safety of our children, that we are lucky to have Marta Santos Pais as our leader in that effort. Thank you, Marta.
Thank you very much, Jim, and good morning to you all. I'm really very honored to join you and delighted to be learning from your wonderful work. I'm sure that we will leave tomorrow's discussions with renewed energy and commitment to do exactly what Jim has anticipated. I'm really very pleased with the opportunity of addressing you and talking about a question that, of course, is very dear to you all, which is the prevention and elimination of violence against children. As you know, and we heard Ms. Bachelet just mentioning it, the protection of children and of each and every human being from violence is a fundamental human right. It has been recognized by many international human rights treaties, and it is a core dimension in the Convention on the Rights of the Child, and it's, in fact, today, 3 optional protocols. The Convention is very clear in condemning all forms of violence, and it lists so many examples of the situations where children may be at risk and should not be acceptable. From those that are very obvious, such as protecting the child from torture, inhuman or degrading treatment or punishment, to the protection of the child from being sold, trafficked, sexually exploited, or in fact exploited through work. But it also touches on other areas where the child may be at risk of violence when the discipline in the school is compromising the human dignity of the child, or when within the family the child may be victim of neglect or injury or ill treatment or emotional, physical or emotional ill treatment. So in a way, I think all of us thought we were inventing the future, as Jim was telling us, when the Convention on the Rights of the Child was formulated 10 years after being, in the process of being drafted in '89, with this beautiful vision of a world where violence is not a reality for children. But in fact, there is a strong contrast with reality, as you know, and unfortunately, not only we are confronted with a very high incidence of violence, but this phenomenon remains incredibly pervasive and hidden and is socially accepted. And therefore, it's very difficult very often to consider it a problem, a concern. This explains that for children, it's very difficult to tell their stories. It's even more difficult and risky to report cases. And unfortunately, we still have many situations where institutions and professionals don't feel either the guidance or the courage or the determination to follow on these cases, to report them, to help investigate them, and to bring an opportunity for recovery and reintegration of child victims. But perhaps one of the most striking challenges we all face is that we don't know exactly the magnitude of the reality we are addressing. And in spite of the fact that there are so many good developments, and I'm sure there will many will be shared in the course of these 2 days, the fact is that we are still questioning if we are just touching the tip of the iceberg or starting to understand deeper what the reality is. So this was, in fact, the main reason why the Committee on the Rights of the Child in the beginning of the 90s decided to call for a comprehensive study on violence against children. And this was also the reason why the United Nations decided to engage in the development of the United Nations study on violence against children. Several of you have been associated with the study, but I think it's very interesting to note that when it was presented in 2006, the General Assembly of the United Nations, which usually is quite a formal body, acclaimed and applauded the presentation of the study and the set of recommendations it was putting forward for a forward-looking agenda to change the pattern it had identified of high incidence of violence in different settings, in the schools, in care and justice institutions, in the community, in work settings, and also within the household. And the study felt that it was not sufficient to have a good, sound piece of research that could perhaps influence policies and action, but it was important that there would be a new position in the United Nations that could help oversee the implementation of the recommendations and try to assess how much progress was happening around the world. And this is why the position I find myself in of Special Representative of the Secretary General on Violence Against Children was established in 2009. So I have 3 years of work, and of course I feel incredibly passionate about it and also very humble in front of the reality I need to address. One key dimension highlighted by the study was the need to consolidate data and to have better research on violence prevention and elimination. It was felt that that was a major gap and it had to be overcome. And of course, when I started anticipating what my priorities would be, this was one of the 3 fundamental priorities I have highlighted for my work. It's, of course, not surprising that it is the case. We know all that with sound evidence, governments can make better decisions, professionals can achieve better results, and rather than working on the basis of assumptions or perceptions, we can have a greater chance of achieving the results that we anticipate. And we also know that when we have good data and good evidence, we can inform better planning, better policies, better legislation. We can shape better services and ethical standards for professionals that work on violence prevention and responses for the protection of children. But of course, we are confronted with many challenges. The first one is that in most countries, information continues to be very weak, fragmented, not integrated, as we heard earlier. And at the same time, in the nation, there is this sense that we don't know exactly what we are addressing, and the fact that most of the time, the family knows best, the school will work well, the institutions will have solutions, therefore, why do we need to compile information and to understand who are the children at greater risk or what are the factors of, that create the opportunity for violence to be a reality. And even in countries where data exists, very often, and even in international organizations, I have to say, very often the data is there, but it's not analyzed. It's not, there is no attempt to distill what it is conveying. And even less, it is disseminated and then used to make a difference in the way we do business. So we continue to have insufficient information about what works best and how it can be translated into action and how it can help scale up programs for the protection of children from all forms of violence. So we see, I see in my own work all the time, situations where the protection of children, in fact, is not given the potential it has. Resources are ill-used, coordination of services is not a reality, and there is a very high cost, not only of less adequate action, but also of inaction. And there is no attempt even to understand very often how high the cost is for victims and their families, and also for the nation. Of course, we realize that without good data, it's hard to inform targeted advocacy. It's very hard to mobilize policymakers to be using the right arguments for them to be on our side and to feel the priority of this topic. And we also realize that if we do not have good evidence, it's very difficult to bring the public together with us. So creating a sense of ownership behind this agenda becomes quite a challenge, because people see themselves disconnected from this priority. So certainly we need to do much more and much better. And of course, groups like yours are unique in creating the opportunity to bring the evidence together, what we have learned together, and make it irresistible for everyone. But above all, I continue to think that we need to give it a sense of urgency and repeat it over and over and over again. And I say this being European, I'm just coming from a few weeks in Europe. And I have to say that I'm always taken aback by the fact that with the economic crisis, the easiest solution for government seems to be to cut spending in social services. And the first to be affected are the most vulnerable, certainly children and women. And when it comes to discussions about how do you prevent violence and, support families in doing better their child-rearing responsibilities and not running risks of creating stress within the home because the father has no employment and because the mother is sent away from her own job. There is no attempt even to equate these questions, putting them all together. And it is as if when the crisis is solved, we will go back to these issues. But in the meantime, the tension is growing, and we have, in my own country, Portugal, higher rates of situations of abuse of children, ill treatment of children, sexual abuse, and of course domestic violence that children witness on a daily basis. So the disconnect is really very strong. Now, in my missions around the world, I am really taken by how children fear this state of affairs and how frightened they feel about talking about it. And in fact, they tell about situations of neglect, of trauma, of physical abuse, emotional abuse, sexual abuse. I remember a case recently of a girl who was telling me, my life is about violence, but today is a good day. My father has not yet beaten me. And you can hear this and worse all the time. And of course, when we think about the very young children, that's even more challenging. They have great difficulty in telling about what is happening to them, in seeking help, or even formulating the trauma that they are feeling. And we know from evidence, and of course all of you know this better than I can say, that violence in early childhood is a factor that generates generational violence. And in fact, young people who are victimized by violence will tend to replicate this violence later in life against their partners, against their own children. So if we invest in prevention, we can break this cycle and in fact create an opportunity for non-violence to prevail. Of course, I am confronted with situations where girls and boys are sold for adoption, are forced into marriage, are brought into exploitative work. In some countries, sexual abuse of particularly girls in the school system is so high that now I am being told about a new manifestation of violence, which is sex for grades. Either the girl consents with the sexual favors that are requested from the teacher, or the girl will not progress in her education system. This may happen within the school setting, or it may happen within the home of the teacher, where the teacher is supposedly going to give additional educational support to the child. In other situations in the justice system, we see very poor and vulnerable children being put in justice institutions just because there is no childcare institution in place in the country, and they may stay there for years without even being charged of any wrongdoing. And in some countries, as you may know, children may still be at risk of being sentenced to amputation, to stoning, to life imprisonment or capital punishment. A few months ago, we have had very sad cases, for instance, in Yemen, that naturally we would think would not happen in today's world. It's therefore not surprising that for children, the level of violence surrounding their lives is a major concern. And we might think that this is the case in countries in the south, but also in the north, this is the reality. 3 years ago, the European Commission did a very interesting survey with young people from the 27 member states of the European Union, trying to understand how they saw the priority for governments, what were the major concerns for their lives and for policy making. And it was striking that in the majority of cases, boys and girls between 15 and 18 years of age identified violence and sexual abuse as the highest concerns for their lives and where government should invest most heavily. So this is really around the globe a very important concern. Of course, children express frustration. They express a feeling of sadness and misunderstanding why the reality needs to be this way. They feel very hurt, not only physically, but also in their self-esteem and dignity. But they are incredibly resilient, as you know, and very strongly determined. And I'm always inspired by the fact that even in the worst and most difficult situations, they find the strength to be the best advocates, to generate campaigns, to discuss in blogs, to organize radio programs, street drama, to go from door to tell the parents that girls should not get married before 18 years of age, they should not be forced to leave school, and that ill treatment or emotional violence should not be a reality. Their impatience is really growing by the day, and I want to tell you about one of their key recommendations recently in an important regional consultation in which some of you have participated in the Caribbean region. One of their key recommendations was that we do not want the mere comfort of being told that we will be heard. Promises need to materialize in tangible action with improved legislation, increased resources, and accessible services of quality, and with monitoring and reporting mechanisms to bring violence to an end. They really know what is needed, and they want to be part in the solution. I'm telling all of this just to come, of course, to the more specifically to the topic you are addressing, and that is that we know enough to do what is needed, although there are so many things we don't know yet. And existing studies conducted in regions or at the national level confirm a very high incidence of violence and abuse on children. Of course, in the US, the very good national survey conducted in 2008 is very telling, recognizing that around 60% of children in the country are exposed to violence. In Europe, just to give you another example, in an important survey conducted in the 47 member states of the Council of Europe, one of the conclusions was that 1 in every 5 children suffer some form of sexual violence, and more than 70% of the cases, this sexual violence is perpetrated by people that children know, that are very close to them, very often within the household, the family, or friends. And this has generated a very important campaign with the involvement of parliaments and governments to discuss the issue, to put it on the table, and also to generate advocacy and information materials that can help parents discuss these issues with their very young children. It's not easy to talk about sexual abuse to very young children, but it is important to prevent sexual abuse also amongst young people. We are also learning more about what is happening in countries in the South. And UNICEF conducted a very important study 2 years ago on disciplinary practices by parents and caregivers in 35 developing countries, which is in a way reflecting the situation of around 10% of the child population in the developing world. And the findings are not very different. In fact, they are quite alarming. They recognize that around 75% of children suffer some form of violence within the home. Children between 2 and 14 years of age. Of course, we may be talking about somewhat mild forms of violence, such as shouting or yelling or screaming at the child, but We may also be talking about situations where the child is violently spanked or hit or bitten, including with a belt or a stick or another object. Of course, when the findings of the study were disseminated, we all felt, how dramatic this is and how nothing has been done so far to make it different. But I think the study has also conveyed a very important message of hope, and that's the one I want to emphasize, which is that, in fact, non-violent attitudes within the home are more prevalent than violent attitudes. And in fact, most of the parents who were surveyed and caregivers surveyed recognized that beating the child is not a solution. The punishment, physical or violent punishment of the child, should not be the way. They simply don't know what else they can do. And therefore, the opportunity to invest in alternatives, in positive discipline, and supporting parents with good parenting messages and capacity, in fact, creates a different opportunity. And amongst the families where this was a reality, where there was a greater engagement between parents and their children, including around the education activities and life of the child, the prevalence of violence was much less visible than otherwise. I also feel very encouraged by the fact that, with the support of many of you, and Jim has been associated with so many of these initiatives, we have more and more studies being finalized and developed in regions such as Asia and Africa. And of course, these surveys are very important, particularly when they are done with a very wide scale of interviews with young people, rather than assuming what others assess of the life of young people, but particularly when this is done with very clear ethical standards to engage the young people without creating harm or without supporting the trauma the child may feel by contributing to these surveys. And I want to tell you a little bit about the study conducted in Tanzania. I'm sure that my colleague Teresa Kilbani from UNICEF and Jim could tell you, and so many of you could tell about many other examples. But I think Tanzania is very special. And why is it so? First, because the survey provided a very comprehensive and very frank picture of the incidence of violence, covering physical, emotional, and sexual violence of young people, and revealing that in the country this has a pervasive and very widespread nature. And again, as in other parts of the world, very often it is practiced by people who are very close to the child. It's not the stranger who comes into the village, it is the people who are in fact expected to be securing the protection of the child. The study was also very interesting because it recognized that although there were important services in place, health services, police and others, who could be ready to support and prevent the incidence of violence, the fact is that children and their families did not trust the services enough to come to seek help when they were at risk or when they had been victimized by violence. And this, of course, was important as a red flag for the government. But perhaps the most strategic element in the study was the fact that it was planned, conducted, implemented, disseminated by a ministerial task force representing all different departments in government, engaging civil society organizations, religious leaders and communities, young people, international agencies, academics, and others. And this was very important to create a sense of ownership, to help realize the multidimensional nature of violence, and also to keep the child, the holistic child, at the center of the concerns, rather than running the risk of compartmentalizing the child between health and education and justice or other departments, which was the traditional way it had been envisaged in the country and in so many other countries. Another aspect that I feel is very important is that the findings of the study were presented in a very high-level session in 2011 with the presence of the president and all ministers who had been associated with this process. And rather than presenting the findings, which were quite staggering, as in any other case, the findings were presented with a policy agenda, a policy response to overcome the concerns that the findings were reflecting. Therefore, the nation got not only the difficulties and the challenges, but also the way forward. How can we change the pattern? At the same time, this generated a huge public debate, which of course made it part of everyday talk in the village, in the city, in the government. Since the launch of the study and the policy response, there has been great investment in implementation efforts, including to raise awareness and mobilize public support, but also to encourage young people and adults to look at it, at this phenomenon with a serious attitude, rather than feeling frightened to tell about it and to seek help. And to sustain the momentum and re-energize implementation efforts, the same multi-sector task force decided to develop a national action plan for implementation. The plan was initiated a year after the launch of the findings with the same actors. And what is very interesting, it is the fact that not only it identifies changes in legislation, in policies, in services, to support prevention and responses to violence against children, but it also has a communication strategy to reach out to everyone, including and especially young people. And at the same time, it has a monitoring and a reporting dimension that will help to assess progress along the way. Of course, as you may imagine, this creates very high expectations in the people, amongst children, amongst professionals, of course, amongst all of us who want this example to be replicated in so many other countries. But it also creates high expectations about where resources are going to come from to ensure that implementation can be sustained. And that is a big, big challenge. And I hope the success of this case, which is being replicated in other countries such as Kenya recently, and hopefully very soon in South Africa and other parts of the world, will not feel discouraged, because in fact there was this beautiful opportunity, but then it didn't materialize into something that made a difference. These are promising initiatives, and of course they show that when there is strong political will and where there is a sense of commitment that is widely shared in the country by policymakers and people, normal people, families, it can make a difference. But of course, between this very good example and the overall situation in the world, there is a big difference. And over the last year in my office, I decided to, with the help of many, many partners, try to understand how much change is happening in the world and by governments in particular in moving this agenda forward. So we developed a global survey that was sent to many, many partners, starting with member states, asking for a number of questions, including on the role of data and research and how this was a priority for the policy agenda, the national agenda of each country. I want to very briefly tell you what the results were. The first one is, of course, that countries have a lot to say. There was a great effort in developing legislation, adopting new policies, sometimes creating new coordinating mechanisms to bring all these pieces together. In some cases, good studies, like the one in Tanzania. But overall, this topic is not yet a priority in the agenda, and particularly research and data are not a high priority. So we still find uncoordinated policy interventions. We find dispersed pieces of legislation. We find very insufficient investment in the support of families, in capacity of professionals, in developing safe and child-sensitive mechanisms that can give children the hope that they can seek help and tell their stories. And of course, when it comes to data and research, very, very few pieces of information were received by us. In fact, a few examples. In most countries, there was a recognition that this is a big gap. And although 31% of the governments reported that they collected some kind of data related to violence, the fact was that most of the time it was not child-specific. It was on the general population. 10% indicated that they collected no data at all, and the most striking result to me was the fact that more than 55% did not even care to address this topic in the global survey. I assume because they didn't have much to say. Another finding from our survey was that coordination between data sources is a big challenge. Sometimes there are many institutions that are collecting data on different dimensions, on the way some services work, or on some forms of violence, but at the same time they remain very dispersed and are not integrated. Very often they are based on different definitions and using different indicators, so also the ability of integrating this reality is very, very challenging. In addition, a big challenge has, of course, resulted from the fact that statistical offices may feel they work well, but between what they do and what they put out into the public and what gets into the policy-making table, there is one endless road, and most of the time the bridge is not there. And therefore, we may have the best data, but it's not used, it's not known, it's not made public, and therefore even the public scrutiny to create social demand is not present in the countries. So we find it very difficult to gain a very holistic view of the incidence of violence and the cumulative impact of different forms of violence in the lifetime of a child. And most of the time, there are invisible, sensitive, and neglected areas that get no attention whatsoever. It is therefore very important to invest in this area. And this was the reason why a few months ago, I organized with some of you who are also present here, a meeting to reflect on what do we know, what are we missing, and how can we move this agenda forward. And I wanted very briefly to identify the key recommendations that came from this reflection, because I hope they can also be helpful for your own deliberations. The first conclusion that we drew was the fact that we have sound evidence on a number of questions that are critical. And we also know of very important and instrumental experiences and practices that can, in fact, give us a way of preventing better and more effectively the incidence of violence and be more effective in the protection of child victims. If this information is well used, in fact, we can have better advocacy, better laws, better policies, better resource allocation, and make a difference. Therefore, we know enough to act, and we have no excuse not to act or to be passive or to be indifferent. Unfortunately, that's not the reality. We also recognize that we know enough about what is missing. There is consensus about key areas where the gaps persist. And therefore, we have an opportunity to promote enhanced synergies and partnerships to move quicker in this regard. We identified a few areas where, in fact, we know we need to work better. First, the exposure of vulnerable children to violence, the children who are at risk. I mean, going back to Tanzania example, children with albinism, children with disabilities, children in detention were not covered by the survey. So difficult groups are left out because they are more invisible and we don't have the data about them. The second area where we know we need to work better is the exposure of children to violence in situations of economic recession or crisis and social instability. The third, the cost effectiveness of interventions for violence prevention, for early detection and intervention, for recovery and reintegration of child victims. And the fourth, the human and social cost of violence and the high return of investment in prevention. And of course, studies in the US are very strong in this, in some other parts of the world, but I'm using my own country and region, Europe. This is not making any difference, and yet we could make a very important argument in favor of investment in violence prevention and reducing the impact of the economic crisis in the European Union. The second big conclusion we drew was that children are not only the object of our observation, but they are partners in this process of understanding how violence impacts their lives. They have a critical role in data gathering, in the analysis, also in the dissemination of the findings, and in informing solutions and policy approaches that make a difference and prevent violence better. But there are many challenges that we need to overcome in this area, particularly to be ethical in the way we engage with children and finding solutions and approaches that bridge put aside the risk of being manipulative or patronizing, and at the same time guided by the best interest of the child, ensuring that we respect the views of the child and the expectation of the child, but at the same time protect the child from any risk of being affected by harm that is unintended but may be occurring. The third conclusion was this important area that you will be emphasizing further, which is to narrow the gap between what we know and how we use what we know to make a difference. The importance of investing in communication, in messaging, in decodifying what we realize is critical so that those who are not experts feel absolutely an irresistible agenda to support, joining hands with us in moving this process forward. And the final conclusion and recommendation was, to me, it's a very obvious one, but we need to realize it perhaps more systematically, which is that data and research are not politically neutral. And countries very often prefer to have the right political image than to be frank enough and self-critical enough to realize what is not well for the children of their own country, because this is part of their responsibility as leaders of the country. But this is an area where I find that the studies that have been conducted recently, like the one in Tanzania and in a number of other countries, are showing a very promising way of not only acknowledging what is wrong, but also anticipating how the wrong can be transformed into something positive and promising for children. This was what I wanted to tell you. Of course, the most important thing is to realize that there is so much we can learn from, and there is so much on which we can build to strengthen partnerships and to move this process forward. And there is such a great opportunity to integrate better the information we have at hand across sectors, across disciplines, overcoming this temptation that there are boundaries that cannot be, overcome. And I know I'm a lawyer, so I know better about law, and you will be a medical doctor, you will know better about health-related issues, as if the child is not the same. We can overcome compartmentalized approaches in this regard. And therefore, I want to leave you with another call I heard from a young girl in the Dominican Republic. She told a big audience, positive outcomes become endless when you unite with others. When you care and share, the possibilities of success are at an all-time high. I therefore wish you, with this inspiring much success in your deliberations, and I want above all to continue to be learning from you and joining hands with you in moving our common cause ahead. Thank you so much.